All right, can everyone see the next slide here? So just as a frame and a reminder, the healthcare industry leadership table is a network of small, medium, large healthcare providers in the Seattle-King County region, although we don't mean to limit it to the King County region, who come together to talk about industry challenges and trends, and then flex our collective industry muscle to address and solve some of the bigger issues that not one organization, regardless of how small, how big, how lucrative that system might be. And we always have a network of support partners, education, workforce development, economic development, government, nonprofits, kind of sitting in, listening to industry's challenges and trends, ready to respond, to plug in where industry says this is a need. We have our support partner, foundation that's very strong in King County. We're very lucky that's ready to plug into industry as needed. So for today's Lunch and Learn, this topic came out of the HILT quarterly meeting back in November, when it was recognized that not only is the nursing occupation in a tremendously high demand, but our current nurses, even before the pandemic, were experiencing a tremendous amount of burnout. The effects of COVID-19 of nurses, as well as other frontline workers, include anxiety, depression, post-traumatic stress disorder, and insomnia. And if left unchecked, it can really mean unhealthy and unsafe conditions. It really can hurt the other efforts that the healthcare industry is trying to tackle. For example, the talent pipeline. Trying to get young people excited about being nurses when current nurses are already burnt out. It's difficult to show them kind of what the amazing work that nurses can actually do. So to address this topic, the 3 goals for today's Lunch and Learn, we have our amazing Dr. Tatiana Sadak, who will be presenting on clinical setting stress, the COVID-19 effects, and resources to tackle burnout. We're going to hear from Robin Lawrence, who is an advanced nurse.
Makes sense.
Advanced practice nurse specialist with King County Public Health, about first responder well-being and that focus that has happened since last January, almost a whole year ago now. And then, of course, we want you all to be able to not only share your own techniques and resources, but to be able to ask questions of Tatiana and Robin. So without further ado.
Well, I will definitely reach out in the next day or so.
If everyone on the call could also,
I appreciate you being the lead blocker on that one. I can certainly
when they're not talking. James, I'm not sure if you have the capacity to mute people. That's great. Thank you so much. So I'll be doing a brief introduction of Dr. Sadak, and then we're going to hand over screen sharing controls to her. So as I was reading about her, this is just the tip of the iceberg. Such a very incredible and tremendously impressive CV. She's a board certified psychiatric mental health nurse practitioner with a PhD that is focused in geriatric psychiatry and neurodegenerative disorders. She has a clinical practice with a focus in geriatric psychiatry and dementia. And she has a plethora of fellowships, including the American Academy of Nursing and the Gerontology Society of America. She's a scholar with the Josiah Macy Jr. Foundation, still also with the Sojourn's Leadership Scholarship, as well as with the Robert Wood Johnson Foundation. She also teaches graduate and undergraduate psychiatric nursing, psychotherapy, and geriatrics at the University of Washington, and she oversees the implementation of new undergraduate nursing curriculum. Again, tip of the iceberg. And with that, I'm going to go ahead and stop sharing my screen and turn the controls over to you, Tatiana.
Thank you so very much, Lizelle, for the introduction, and thank you for the opportunity to be here to speak about this very important topic. So we'll get straight to it. The theme of my talk today is emotional PPE, and I'm going to take more of a broader health systems perspective, but the takeaway point is our healthcare providers and frontline responders in this pandemic cannot be these canaries in a coal mine, where they are themselves just kind of worn out and the sign that the whole system is collapsing. We really need to be equipping our frontline workers with emotional PPE in addition to a real PPE that would protect them from the infection. So what do we know to date since pandemic unfolded? Compilation of large studies show that over 1/3 of our doctors and nurses have clinically diagnosable depression, anxiety, and post-traumatic stress disorder. I mean, these numbers are really significant. And about 40% suffer from chronic treatment-resistant insomnia. Before the pandemic, we already learned that physician burnout is very expensive. There was a large study that was quantifying the financial fiscal loss to health systems from physician burnout that came up with really astronomical numbers. Now, these are pre-pandemic numbers. I think for health system administrators, managers, and for people who are working in the front lines, it's important to have a general understanding of why this pandemic is so difficult on our mental health and what are the signs. So our talk today will be about symptoms, recognizing symptoms, brief interventions, and kind of system-wide approaches that can be taken to help mitigate pandemic-related increased stress and burnout. So I'll be using a lot of materials put together by Schwartz Center for Compassionate Healthcare. They developed a really beautiful body of science and a brief intervention program for healthcare provider burnout. And the slides will be distributed to you and would have links to all the original materials that I'm using to inform this presentation, as well as many other resources. So what are potential stress reaction examples to the pandemic, and what should we be on the lookout for? Our frontline healthcare provider experience drops in their levels of confidence, in their levels of confidence in being able to provide the best care, to have access to the best resources, and to know what to do in emergent situations. They also experience significant anxiety and worry, not just about the outcomes of their patients, but about their own health and well-being, about health and well-being of their colleagues and everyone around them. Many healthcare providers report feeling very helpless and feeling loss of control. They still show up even though they're exhausted. They still show up even at the times when they themselves didn't have proper PPE, when they didn't have proper equipment. They try to do their best when they're understaffed. They try to do their best working in the environments when people around them are kind of irritable and short-tempered, and when they're taking care of people who are much more ill than pre-pandemic baseline. They experience grief and depression, and many areas of their lives can trigger the feelings of grief and depression, and we'll get a little bit more in depth talking about grief later in this presentation. But it's really important to remember that even if your nurse or physician or social workers themselves, they have work right now, and maybe they even have extra shifts and can pick up overtime, they may experience significant financial stressors because their spouse may have lost their work, because they're homeschooling their children, and because they have so many other responsibilities in addition to their work in clinical settings. Healthcare providers report experiencing anger. And anger and sometimes resentment when they perceive that others' actions put themselves and others in harm's way, and feeling frustration of not being able to really discuss this in a team setting. And we'll talk a little bit more about some suggestions for team building and team debriefing. And many healthcare providers report experiencing guilt, a guilt for not doing enough, guilt for fearing for themselves, guilt for sometimes not really putting themselves in harm's way in order to provide the best care possible, and guilt for not being able to cope well because they're exhausted physically, mentally, and emotionally. So I want to very briefly go over the stress continuum model, and I think it's really important to know how the stress and daily frustrations can evolve into mental illness. So when you are in a really good mental and emotional state at your optimal functioning, and even really severe traumatic things happened, you're able to cope, you're motivated, you have reserves, you're able to tap into resources, and you're able to really navigate through it. When your resources becoming thin and your resilience is starting to kind of wear out, then people become reactive. And this is when you notice that people are more irritable, they seem less motivated, they're losing focus, they start developing difficulty sleeping, muscle tension, they're just grumpy, nothing seems to give them joy. You know, this is where, according to most recent statistics, at least 40%, but maybe larger number of our healthcare providers are at. They're in the very reactive stages of stress. And when that goes on unmitigated, you go into the area of stress injury. And stress injury is manifesting as loss of control, panic, not really feeling like you, your own self, experiencing excessive fear, guilt, and shame, and not being able to really show up for your family, for your work, for yourself, as well as you usually would. And when that stress injury goes unmitigated for a long time, it transitions to clinically diagnosed mental illness, whether it's PTSD, depression, anxiety, substance abuse. And those are persistent and a lot of times treatment-resistant symptoms. There are different causes of stress-related injury, and we really want to intervene before the injury occurs, but it's really important to be aware of the causes. So if something traumatic and life-threatening happens, that's more well understood cause of stress injury. But grief and loss, grief to the loss of people, things, definition of oneself, your own self-esteem and effectiveness, they can cause stress injury. In a conflict, when you're witnessing behaviors of others that may violate your moral values, when you witness yourself maybe engaging in the behaviors that make you question your moral values, this in a conflict can result in stress injury. And when you're just exhausted, when you just keep going and going and going, resources running thin, your energy, everything is running thin, and there's no end to date. Those are all very common causes of stress injury. So in the pandemic, commonly reported by healthcare providers, sources of moral injuries include having to make life and death, triage or resource decisions, knowing that you're not able to save all lives, wanting to show up for work and to volunteer for dangerous rotations and assignments, but really feeling like you can't, you're too fearful or anxious, or you're too concerned about others in your family, for example. When your working duties affecting your family, your loved ones, your ability to fulfill your other responsibilities, getting burned out to the point where you don't experience as much empathy and compassion as you used to, and feeling guilty about it. Surviving when others dying. Many of our healthcare providers lost not only family members and friends, not only patients, not only people they know, but also their colleagues to COVID illness. So there's a lot of grief and loss and survival guilt reported by healthcare providers. So why is it difficult to intervene to prevent the stress-related and moral injury? And some of the main factors identified, again, from a large survey of healthcare providers, is because those who are injured they may be the last one to recognize that they're susceptible and that they're actually injured at this time, and that they're not just navigating as usual and that they need help. There's also significant stigma of mental health, mental illness, and asking for help. So many healthcare providers feel that it is their job to provide care, not to ask for help. Your idea of what's stressful and stress tolerance and the thresholds of what's not acceptable stress to you also change over time, and you become desensitized when stress is growing and growing and growing. And the event that may have caused stress injury may have been happening a long time ago, or maybe small chronic events that add up over time. So all of these are limiting factors to developing self-efficacy, hope, sense of safety, calmness, and connectivity. So there are many intervention models. One that I want to briefly describe today is stress first aid model. And it seems very simple, but I think if these principles are incorporated within healthcare teams and health systems steadily over time, they can make a huge difference. So with the stress first aid model, you observe, you check, you listen, you coordinate, cover, calm, connect, restore effectiveness and competence and confidence. And we'll cover this in more detail. So in a team meeting context, what would be the question that could lead discussions in identifying different steps of stress response? Gathering in a small team setting, in a small group, and asking, how did this day go? How did it affect you? How is your sense of safety? Restoring calmness. What changes have occurred regarding sleep, ability to keep calm, and having navigating a group discussion of what coping strategies work for people? Connecting. Has there been an impact on your ability to connect with others and offering frequent opportunities for team members to connect? Competence. Do you feel any concerns about being able to handle things and sharing other people's coping strategies again? And confidence. Have you noticed change in your confidence in yourself, your leadership equipment? So those are just examples of guiding these important conversations. In a minute, I'm going to be calling out for all health system leaders to become trained and skilled in psychological first aid and initial stress check and stress responses. How do you do that? And here again, there's a lot more materials and information if you want to take a look, but very basics of assessing if somebody needs help and triaging who needs your attention and who needs team support at the moment is you're observing people's behaviors and behavioral patterns. And when you observe something concerning, for example, person is exhausted and irritable and doesn't seem to be able to focus and really making bad clinical decisions, but not aware of it, recommendation is to state your observations of behavior in a very neutral way, just the fact without interpretation of or judgment. Let them know why you're concerned about this behavior, really separating behavior from the person, bringing in specific issue that you observe that you're concerned about, and try to understand the other person's insight into their behavior. And respond by providing options, really discussing what are some respite opportunities, normalizing that many people feel this way and really making it okay to ask for help. So a paper just came out very recently in a viewpoint looking at how can we address the sources of anxiety among healthcare providers during the pandemic. And what a national survey of healthcare providers showed that healthcare providers want their managers to hear them. They want to be protected physically and mentally, emotionally. They want to be prepared. They want to have information at their point of care about most current and relevant knowledge for managing different difficult situations. They want to be supported by the team and the manager. They want to feel cared for as a person, and they want to be honored. So this is a really important article. I also give you a link to that. Take a look at it, because I think as a healthcare manager and healthcare system leader, it can help you decide on how to get yourself set up for success in meeting the needs of healthcare providers. In order to prevent the parallel pandemic, the National Strategy for Protecting Clinicians' Wellbeing has been developed. And some of the key recommendations of this national strategy is to develop job descriptions for chief wellness officers and well-being programs in all health systems, to ensure psychological safety of clinicians, and to make sure that all the people in position of management are trained in assessing and addressing psychological safety, and also allocating funding for clinician respite. So some brief recommendations to health system leaders. What can you do today in addition to the national recommendations is coaching all healthcare providers in management role and in all roles in your system, in health system, in grief responses and in psychological first aid. And these are wonderful free courses and resources that are brief and self-paced that will give you really good mastery of techniques of psychological first aid. We train all of our nursing students in psychological first aid, and it's a really, really wonderful and important skill. What we'll also hear from health systems that already have a lot of wellness and clinician support services is that it gets very confusing and clinicians don't know, do I call a peer support line? Do I call a crisis line? They get kind of confused and frustrated and can't navigate the services. So if you're fortunate to be working for a health system that already has a lot of wellness services in place, create a peer support kind of navigation service where clinician can call and say, this is my issue, and be given phone numbers and resources that the health system has that would address their specific need. Creating system-wide plan for destigmatizing mental illness and encouraging clinicians to ask for help is really a must if we want to help to sustain our clinicians' wellness. Planning activities that are focused on team building and cultivating and restoring trust and team identity, and regularly expressing gratitude and really honoring your clinicians would be really important. And of course, financial and tangible support and respite. Many healthcare organizations developing recharge spaces where clinicians can just step away and just relax and decompose. Clinicians report that this is very helpful to have small space to do that. Many organizations develop weekly blogs and newsletters where clinicians can share their experiences. There's a really wonderful app that VA developed called the COVID Coach that kind of takes people through stress management and brief interventions. Another wonderful free app called 3 Good Things that really shows people how to practice gratitude on a daily basis and to do cognitive restructuring. This regular gratitude practice is well supported by literature showing that counting blessings versus counting burdens can really restore people's mental health. And here I'm giving you an example of using this counting blessing strategy in regular medical rounding. So instead of saying, what went wrong today, asking what are 3 things that are going well around here and 1 thing that could be better. So here's a list of resources specifically from the Schwartz Center. I highly encourage you to take a look at them. Here's many other resources and free links to free training for healthcare providers' well-being. Many programs are offering mindfulness meditation, self-hypnosis, exercise free of charge or at significant discount for healthcare providers. All right, that's all I have. And if you're a healthcare provider, thank you for all that you do. And if you're a health system, thank you for supporting healthcare providers.
Thank you. Thank you so much for, wow, I mean, introducing the stressors related to healthcare, but even as I was kind of listening and reading, it relates to, you hear something that's happening in the news, in the media, across the world, across the nation, and it affects humans, not in their professional life, but personally, right? And so, it's definitely a consideration that I think all of our HILT network can really take back and take to heart. Some of those strategies, not just to identify kind of the stress first aid needs, but then like how to overcome the stigma of kind of stress in the workplace. Thank you so much for that. The resources and what we can do, again, that can be related to any industry, your personal life, setting aside a room that you can go in your own home. So just having a reminder that those strategies and mechanisms exist out there, and it's kind of up to us to implement it and move those along, is tremendously helpful. Just for everyone, we are planning on posting the recording of this presentation as well as the PowerPoint up on the HILT website within the next business week. So you'll have those resources, those amazing resources that were shared. So without further ado, I am going to go ahead and introduce our next speaker that we have. Our next speaker is, everyone see my screen here, make this big, is Robin Lawrence. Again, she's an advanced practice nurse specialist for King County Public Health. Oh, darn. And I believe it was last January, she was assigned to be the officer, safety officer for the public health of Seattle King County's coronavirus response, which included overall coordination of the incident command system, the isolation and quarantine facilities, community testing sites, mobile testing, contact tracing, and teams doing outreach to those long-term care facilities, child care and daycare programs, shelters, businesses, schools, and BIPOC communities, among others. The focus of Robin's work with the coronavirus response has also been to prioritize that first responder well-being. And so, we really wanted to be able to give Robin some space here just to share what King County Public Health has been doing with regards to first responder well-being, and kind of what has seemed the most important aspect of preventing burnout for nurses as well as for first responders. So with that, I'm going to hand the mic over to Robin.
Thank you very much. And thank you all for all that you've done during this past year, because of the coronavirus and the response has affected all of us. So when we started our response way back at the end of January, we realized very quickly that these were unprecedented times. There would be a stress accompanying us throughout our response. And so we began talking about stress and talking about well-being from the very outset. And then throughout the response, we have been doing the same. One of the things that I think is really important is that we've acknowledged that this time is unprecedented, and we've acknowledged each time another issue has surfaced. Between lockdowns, at-home schooling, racial injustices, uncertain political times, as these things have come up, some of them more impactful for some than others, we've really acknowledged them. And our leadership has been really great in being reflective and making sure that we bring these to the forefront and recognize that they're important. And I would just like to say, I think that a lot of what I'm going to say, you'll hear similarities to some of the things that Tatiana said. Always feels good, right? That we've been kind of going along the path that's backed up by research and experience. The other thing we've done is really supported the leadership. I mentioned they've brought things to the forefront, but they've also really supported this focus on well-being. From the beginning of the response, we instituted a stress check-in that we have done almost every 2 weeks. And it's a very simple thing because we really wanted people to respond. So it's had 3 questions most of the time, which are, what part of the response are you involved in? And how is your stress right now related this week related to the response? And that's really enabled us to kind of judge where people are on the continuum of stress at a particular time. We recently added another question about how well are you able to access and use resources that can help you deal with the stress. And another thing that we have done with a survey, a more expanded survey, is we asked all sorts of additional questions about barriers to resources to support mental health and well-being, and particular needs people have. And then we use that to guide some of the tools that we were able to provide. So we have partnered with resources in our organization. Fortunately, we have a large organization with people dedicated to such things. But we have a website that's dedicated to responder well-being. There is a self-care toolkit that talks about compassion and well-being and just gives lots of ideas for self-care. We've had mindfulness classes offered for responders. We've had debriefing groups that were run by our EAP personnel who were groups who felt like there was a lot of stress, could ask for this to have on a regular basis, have someone come in and talk to them. I believe they've all been virtual because that's where we were when we started those. We've had live virtual exercise classes, which people really seem to love. And then we just remind people all the time of the employee assistance program and the mental health support that's offered through our insurance policies. And we've had other things like mindfulness videos available for people. And in the beginning of the response, we had crisis dogs who visited. And that was a really big hit. That's when we were back still in person working together. Unfortunately, that had to stop at one point. But so we have offered a real variety of things for folks. We have brought gratitude in quite a bit. In the beginning of the response, we asked people to contribute to a word cloud. And we still have that hanging around the building. So we're not there very often, but when we go in, that's just a reminder of all that we're thankful for. And we have also incorporated other aspects of mental health and well-being support into our meetings and briefings. So I would say one of the most successful things that we've done is for much of the response, I'd led a mindful minute in our morning briefings and our weekly meetings. And the fact that it's been part of the briefing itself, I think really makes it much more valuable to people than some of the other offerings. We have a really, really dedicated group. It's really hard to get people to stop and take an hour to go to a mindfulness class. But if you say, if you're interested, just hang on at the end of the briefing. We're going to take 3 minutes and breathe. Most people will do that. And people have been incredibly appreciative for that. And in fact, many of our meetings throughout public health, we start with a grounding exercise now, which is really helpful. But that mindful minute really has hit home, and I think that's because it shows support of leadership, which I think is so very, very important, giving people the time and space. And it's nothing that they have to go out of their way to do. It's right there for them. I think that leadership intention is very, very important when it comes to well-being, and it needs to be there. And sometimes when people aren't maybe able to set the boundaries from themselves in terms of self-care because they just want to do the best for everyone around them and serve their community, I think it's important for leaders to help them set those boundaries and to show or make tough decisions, right? That maybe we won't be able to reach you on the weekend, or maybe let's see, maybe we won't be able to reach you, or we're going to just tell everybody that this weekend nobody should be sending emails, right? Everybody should be taking that time off. So that's, I think, really important and has made a big difference. Excuse me one second, because I have to find my notes here. And the other thing is, I think that's important, is recognizing the need for support at all levels. When we've had meeting for our supervisors and intended to talk about how supervisors are doing and then how people can support their staff, we really found that supervisors needed that time so much just to kind of talk about their own issues. And we all know that unless you really take care of yourself, you can't take care of others. So we found that a lot of people were kind of in that space of, we really had to focus on taking care of yourself before we could move on. So I do think the most important things going forward are really to figure out how we balance. It's a sort of an age-old human question, how we balance need with resources, and but that we really encourage people at leadership levels just to take the time to encourage people to take time off, that they really support people taking breaks. There's so much research behind the importance of taking breaks. It really provides a reset. And then I think the more we can incorporate mindfulness into really everything we do. I'm just such a fan of mindfulness as a source of self-awareness, as a really a safety tool for enabling people to stop and think before they proceed into a situation that may be unsafe, and just as a tool for resetting and reminding people to breathe. So that's just kind of a summary of some of the things that we've been doing this year.
That's great, Robin. Thank you so much. I really appreciate how you explained how you've been really thoughtful about implementing strategies from the very beginning, and seemingly strategies that don't cost any additional really money or resources. Incorporating a mindfulness minute, ensuring that leadership's intention was very visible, and normalizing some of the stress first aid things that Tatiana brought up, right? Taking breaks. We do have one question in the chat for you, but before we launch into that one question, I just want to make sure everyone knows this now is the time where you can ask your questions to Tatiana and Robin. Also, if you want to unmute yourself and share any strategies, mechanisms, or resources that you have implemented at your organization, or share them in the chat, this would be the time for that as well. And so I will just go ahead and kick off this portion of our Lunch and Learn with a question for Robin. What kind of response rates are you observing from the survey, and what unique items have you learned from the survey?
Well, I wish I could give you a straightforward number of response rates. The challenge has been our response has been changing constantly from the beginning. And so there our list of people to whom we've sent the survey has been in constant flux. And so numbers, I mean, I would say probably maybe around 25 to 50% of people have responded to the survey, but it's really varied over time. And we've had to rely on sometimes on it being cascaded by supervisors down to folks. So it hasn't been 100% reaching everybody, but we really, we've gotten a decent amount of responses over time. I mean, it's been going on for a long time now, right? Almost every two weeks for a year, and we still get a fairly decent number of responses. And you know, I just find that really helpful, especially because we can see which groups are experiencing the most stress at any given time. And usually we've been able to understand why that's happening and really almost predict that that would be so. Unique items that we've learned from the surveys, you know, it was really the larger survey that we learned the most from. The others just kind of a point in time or a view over time, I guess. I will have to take a few minutes to think about that because it's been a little while. We're about due for another one. We were going to try to do that one every quarter now, but we've only had one so far. But it was really helpful to learn about barriers and what people would like to experience. And that's actually the reason that we started the online exercise class. That has proved to be one of our most utilized resources. How do we help others who may need the help but are resistant to outside support? You know, my experience in life is that usually people who are the most stressed are the least able to kind of ask for and receive help, right? Because when you're so stressed that you can't even think of how someone could possibly help you, that's the toughest thing. I really think there's a big role for leaders to play, and you know, the normalizing of reaching out for help plays a big part. I mean, we really have talked about this constantly and encouraged people constantly to reach out for help as they need it. You know, I think there are different ways that different things people respond to. So offering a variety of ways for people to get support and assistance really helps, but I don't have a magic answer for that, I guess.
So James had a question for me if we're seeing more burnout and stress responses based on different settings. And my understanding of the literature and just talking to my colleagues is that there's different issues in different settings, and the burnout and stress kind of manifest differently. It almost seems to me that those who are in the emergency rooms and COVID ICUs, there is more specialized support programs were developed kind of sooner and more resources were available, and this kind of peer-to-peer debriefing, 24/7 mental health. Most health systems kind of right away gave resources to the frontline providers. So the burden and stress and kind of immediate extent of mental injury may have been larger, but they also have gotten kind of more recognition of the fact that an expectation that you would be burned out. And I think a lot of health managers kind of would come in with this expectation saying, you know, we're going to be running on empty, what can we do? It is in other practice settings, in ambulatory care settings, in public health settings, where I think the development of the resources and the development of messaging that this is so hard. Even if you're seeing 1/3 of your regular patients loads, you know, everything else going on around you, the stress within and outside of work is impacting you. I think this culture shift in non-emergency settings, in my experience, have been a little bit slower to build in. Of course, outside of the Seattle Public Health, who kind of immediately took a public health approach, but small practices that that, for example, switched to all virtual, you know, they had to renegotiate the roles of different healthcare providers. You know, what does RN do in an all virtual practice? What does medical assistant do? You know, what are the responsibilities of providers? And people were so busy switching to remote telemedicine that sometimes this human factor and kind of the healthcare provider support didn't quite catch up or caught up a little slower. So I'm seeing different types of burned out and different types of kind of express stress in different settings. Did I answer your question, James?
Yes, you did. Thank you. And kind of as a follow-up to that, I did have a question, and just kind of trying to look at the different populations, because I do see some of our more, I'll say, matured or seasoned workers, if you will, in the healthcare professions. And I think they come from a different mindset of kind of these kind of tragedies. I was wondering if you had any feedback on what you're hearing from our young professionals and the millennials that are kind of going into the healthcare. Just what are they saying, or, you know, are they feeling the same impacts just the same, or is it any different?
So I can speak on behalf of nursing students, and maybe we'll ask Robin to speak
Sure.
on behalf of younger licensed working professionals. So I work very closely, specifically with undergraduate nursing students, and we graduated 2 nursing student cohorts during the pandemic. One of them, an accelerated cohort, was greatly restricted by clinical opportunities that the students had. So students were coming into the workforce with a lot of enthusiasm. They really wanted to be frontline providers. So, you know, you would expect kind of people shying away from a nursing profession with the understanding of much higher risk and much higher cost to self. But our applications for nursing students nearly doubled this year. And we already had, you know, massive number of applications. It could also be partially because we waived the requirement for a certain amount of direct care kind of clinical hours that students need to apply to qualify for the program, because it was very difficult to get the shadowing and volunteer healthcare experiences. But nevertheless, the fact that there's so much more interest in becoming a nurse in this pandemic year is a testament to our young people are very optimistic and wanting to choose this profession. And I speak with students, you know, on a regular basis, and their big concern is like, would I be prepared? Would I have enough skills to practice? And so what our wonderful clinical partners have done in inpatient and ambulatory residencies, they're really building up more of a kind of hand-holding and supervision for this brand new nurses who are coming in, who may not have had as many clinical experiences because of the pandemic, so that they can train and prepare them. Though in the last 6 months, you know, we are almost kind of as usual, our clinical placements are working in all the settings. All of our students in the last 2 cohorts who graduated during pandemic had an opportunity to serve at the Seattle King County COVID call center. So it's been an amazing partnership, and our students they're really grateful for this opportunity. Many of them, want to go into pediatric nursing, OB, ICU, and they were a little resistant. They're like, why are you putting me in a call center answering phones? Like, how am I going to learn nursing skills? And every one of them, week 2 of their rotation at the call center, saying this is the most valuable experience we could have in nursing school, because we really learn how to be a nurse, how to use critical thinking, and we understand the needs of the community. So in a way, there's been a lot of silver lining, and I'm seeing a lot of enthusiasm from this new generation of nurses. But I want to give it to Robin to kind of maybe talk about generational differences in attitudes and stress and burnout.
Robin, looks like you're on mute.
Yeah, sorry. I don't know that I can really speak to that, because I am not necessarily, I just haven't seen that, I guess. I have seen people having a common sense of purpose and really being buoyed up by that sense of purpose, and being really dedicated at every age. I'm astounded, impressed, and grateful at all of the people we have working on the response, and just amazed at their tenacity and just dedication.
Yeah, that's amazing. I mean, thank you, Tatiana, and thank you, Robin, so much. I mean, I'm so happy to hear that our younger generations are really wanting it and really thriving for it. I was kind of worried, because I haven't really met too many young professionals, but that really makes me feel really good. Thank you.
Great. So I know we have about 5 minutes left. And just to kind of close everything up, I'd love to just give the floor to anyone who wants to kind of chime in with kind of what do you think will be the most important aspects of public health well-being to prioritize in the coming months, whether it's the integration of really easy practices like a mindfulness minute into morning stand-ups, or whether it's using some of these resources to share with staff quickly. What are some, again, things that we can prioritize as a healthcare industry to help support our frontline workers in the next coming months?
I'll chime in. Something that I heard was the relaxing, recharging rooms. I thought that was awesome. I'd not seen that. And what I wondered about it is, kind of even at my own workplace, if we implemented something like that, I just wondered if that room would be a place where, it's like kind of you go in and nobody, I don't want to say like nobody should talk about, pressing matters, but it's not a place to have those discussions, right? It's a place to get away from it and not talk about things that maybe people do want to talk about. So it's a time to relax.
Room. It's
Right,
a quiet room with aromatherapy. You can put a fountain in, you can put a candle in,
Okay.
whatever your fire codes allow. It's a kind of shut down, reframe, recharge room, not a conversation
I
room.
thought that was awesome. Wow. And that's something that I think we could implement in all of our areas of wherever we're at or working, or even have that mindful minute. I really appreciated that. I thought that was really helpful. Thank you.
So from my standpoint, the most impactful single action that everyone must take, not just can, but must, is to destigmatize mental illness and that it's a weakness to ask for help. Because if our healthcare providers don't ask for help, we are doomed, right? It's not compatible with life for healthcare providers to feel like they have to be such a superhuman that they can't ask for help. So I just really call all the health systems to think about this very deeply.
That's important.
Great. All right, with that, looks like we have a few free minutes for you to enjoy your lunch by yourselves. Maybe these can be your mindful minutes for today. And as we move into our Wednesday afternoons, thinking about how we in our own lives, to Tatiana's point, can destigmatize the need for self-care and mental health, destigmatizing mental health as an illness. So thank you so much for your time today, Dr. Sadak and Robin. Snaps, this was really tremendously helpful. If you have any follow-up questions, please feel free to email myself and I can forward those to our speakers as needed. This presentation and the PowerPoint will be on the HILT website again within the next week. So look out for that. And with that, have a really good afternoon. Thanks, everyone.
Thank you.
Thank you.
Thank you. Nice to meet you, everyone. Thank you for the
Nice to meet
invitation.
you. Thank you.